I want to go back to, we've talked about J.K. Rowling quite a bit, facing criticism, again, after describing hormones and surgery for transgender people as a new kind of conversion therapy. Now, the Harry Potter author posted a series of tweets on Sunday claiming many health professionals are concerned that young people struggling with their mental health are being shunted towards hormones and surgery when this may not be in their interests. Many, myself included, believe we are watching a new kind of conversion therapy for young but gay people who are being set on a lifelong path of medicalization that may result in the loss of their fertility and or their full sexual function. But transgender activists and allies have pointed out that trans people face a long process when trying to transition, and surgery is currently only available to those over 18. A Stonewall survey last year found that of the 3,398 trans patients who spoke to the NHS Gender Identity Service between 2016 and 2017, less than 1% had expressed regrets or detransitioned. So just how concerned should we be about young people being given hormones and potential surgery? Suzanne Evans is a psychoanalytic psychotherapist and former senior clinical lecturer at the Tavistock and Portman NHS Foundation Trust, who worked in the Gender Identity Development Clinic for Children. Susan, good afternoon to you.
Good afternoon.
This area...
Just to be clear, I don't work there anymore. I'm retired now and in private practice.
Okay, sorry, I thought I said former, but nonetheless, happy to clarify that anyway. Nonetheless, I mean, this area has kind of, this whole debate, this narrative has exploded almost from nowhere in recent years. How did we get here?
Yeah, it's a very interesting question, and I think the answer is multifaceted. I think there are all sorts of contributing factors to the rise in the number of children who are gender confused, if you want to call it that, or believe they may be trans. But I also think there has been a lot of promotion, if you like, and activism in the area. So I think it's as I say, not easy to say why there's been such a growth, but there certainly has.
I mean, some, I suppose, would say, well, that's a good thing because maybe this was something we didn't talk about before, and now we've opened up, that we've removed some taboos. We might have created others, but we've certainly developed a conversation, as it were, that wasn't there before. So that would be seen by some, I suppose, as a positive. The other side of this, which I think is sort of where the J.K. Rowling kind of line comes in, is that we might be in a very dark and dangerous place where we are misgendering people, assuming somebody is of a different gender, and in fact it's nothing of the sort. Is that a genuine concern?
I think that's absolutely right, and I'm sure you know about the Newsnight programme where several staff who had left the service raised concerns, and there's currently a case that Sonia Appleby, who works at the Tavistock, who is the lead child safeguarding officer, has also expressed concerns, because I think what's going on is, look, children can be very distressed, confused for all sorts of reasons growing up, and as I say, they're multifaceted in their presentation, but the work of any kind of psychologist or psychotherapist should be to get to know the child. When they present as distressed, you're trying to find out what has caused them to feel this way, to get to know who they are. And I think the current problem, and this is where the LGB Alliance have been very outspoken, is that there are quite a few of these children who it is suspected are possibly struggling with their sexual orientation. They might be gay, or they might be bisexual, or they might be having, as is very common in teenage years, a phase of feeling they might be homosexual or they might be heterosexual, but there's confusion going on. So, anyone who works with adolescents knows that it can be a time of change. It's a time of development, of psychological and emotional and physical development. And so I think that the problem is that the memorandum of understanding that got changed was initially to stop therapists or sort of NHS workers or psychologists taking a view that something like, for example, homosexuality was wrong and should be changed in their view. So it was really important we had the original Memorandum of Understanding on conversion therapy, because that shouldn't be what we're doing. If we're trying to help someone who is homosexual, we work with them and how they feel about themselves and the world, etc. The difficulty is that when they added the T to the LGB, they're not quite the same, and I understand why they've been included, because it's really important that anyone who has a kind of different orientation or a different gender identity certainly shouldn't suffer persecution.
That largely seems more political than clinical in this respect.
Well, as I say, it's complex, but I think the problem was that because there was such pressure, a political pressure, I think you're right, on making sure that we were treating trans kids or gender confused kids fairly and with respect and so on, that the pressure has caused, I think, a lot of therapists to become quite concrete in their approach and actually fearful. I've spoken to a lot of therapists and clinicians and teachers who can't speak out because they're afraid that they will then be accused of being transphobic. But I think the important thing is that people should have more time to work with young people, with kids. When they say, I'm not sure who I am, or I feel very distressed about my body, there is so much to learn about that child. And I think the problem is that the way the current rather confusing wording of the new Memorandum of Understanding has been developed
Sorry,
there's been fear of breaking the laws, if you like.
Yes, there is that sense, isn't there? It sounds like if you sort of, I don't know, I say this without qualification, Susan, but it sounds to me that for fear of sounding bigoted or thinking that you have some kind of phobia, it's sort of been thrown into perhaps the wrong category of discussion. And bearing in mind it's still very early days, I would suggest, in terms of gender discussion and issues. And I've yet to meet a clinician who can unequivocally say that they know fully what is going on in this area, and similarly most seem to have huge reservations as to whether a child, even under the age of 13, 14, could ever make that decision that they are categorically in the wrong body.
I think you're absolutely right, and I think I don't know if you know, but I'm involved in a judicial review to question whether children are able to give informed consent over something like this, which is to make a decision in childhood which actually is about their future adulthood and could potentially be very harmful to their body. And I think that's why J.K. Rowling has, spoken out, because she talks with a lot of people. She's well connected, and she understood that there could well be a lot of adolescents who perhaps are homosexual or just distressed, disturbed. Maybe they've been abused, perhaps they're autistic. But sorry, I've lost my thread a bit there. But I think it's so important because my clinical experience, and as I say, people who work in this area, childhood and adolescence are about developing an adult human being. And actually, we don't get there. Our brain doesn't develop until we're about 25.
Well, indeed. So where is that coming from then? From the when... Again, it goes back to that word political, bearing in mind that I think I'm right in saying, we cannot say beyond doubt that we know fully what is going on in this area of gender confusion and kids who may well have some challenges or some issues, and whether that's about homosexuality, whether it's just about, if in the case of a young boy, he might be effeminate, etc. How does a clinician a parent even, come into this and say, well, what's probably going on here, the fact that you're playing with Barbie and not Action Man probably means you're a girl? I mean, who is saying this? Well,
certainly mermaids now have an education package, and I've seen it, that actually sort of says that, and they've got a sort of chart, and Ken or Action Man is at one end and Barb
Yeah.
is at the other. And I think that's the problem, because in an ironic way, what I think I and a lot of other people and J.K. Rowling are saying is that you don't want people who are different in some way to feel they have to conform to a sexual stereotype. If you say you're at one end of the scale or another, and if a girl can't like black and Action Man and mud and football, like I did when I was young, that she might be a boy, and children are so influenced. I think there's a worry of the education packages that have gone into school. I mean, luckily, there's work now being done on that. And I think Liz Truss has certainly flagged up some concerns in the area. But I just wanted to mention something as well, which connects with your question. You see, you gave a statistic about Stonewall saying that only 1% regret transition. The truth is, Gid's clinic at the Tavistock will themselves say, we don't know what happens to our patients after they leave the service. And what I also know from some detransitioners who've contacted me since I've taken part in this case is they've said, I don't want to go back to the service that I feel has let me down. So they don't want to go back to the gender clinics. So part of the misinformation that I keep saying, let's have a good look at, it's difficult because you get told you're transphobic if you say, look, we need to research more, we need to follow up more, we need to understand what is going on.
That's
with
logical, isn't it? What you're saying there is just, surely that's what everybody should be doing, isn't it? Understanding more.
Well, yes, but the difficulty is, you see, for example, if I was to say, in my experience working with young people, they can be very, very distressed, and that's what I had when I was working there. But if you help them and work with them, very often over a period of time, but it would be a long period of time, not 10 appointments over a year. It takes consistent work, and they need to get to trust you as a therapist or, whatever your role is with them. But you can eventually sort of get underneath that, like you would if you were working with someone with an eating disorder. It can take 2, 3, 4 years to move someone with an eating disorder away from their preoccupation with their body weight and starving themselves to understanding something about their more internal state of mind. But it's so difficult because, of course, when you try to talk about it, you get told you're disabusing children of their sort of human rights, or I can't,
But that's what I meant, Susan, when I said it was, about it being deeply political, because it has become hugely politicized. And it appears that when I see people attacking the likes of J.K. Rowling, I'm sure you've probably had some of that yourself as well. It sounds as if you would, because based on what you're saying, you would also get those kind of people throwing those issues out there. It's very easy, isn't it, for someone to say, oh, I disagree with you, so therefore you're a bigot. I mean, that's no way one, I think, would reasonably say for this debate to unfold. But Susan, your response has been brilliant, and your answers incredibly thorough. And I think anyone listening to the incredibly qualified view of Susan Evans there would be thinking, yeah, that's precisely where I thought this debate was at.